Good afternoon and welcome to African Voices platform. My name is Chiwe Chihana. So today we are honored to be welcoming to the studio Melissa Simmonds, who is from the Sheffield Health and Social Care NHS Foundation Trust. She is the Health Equity Community Network leader. Now, Melissa, as a driving force behind innovative changes in integrated health and social care, her leadership is about transforming patient experiences and community engagement in Sheffield. Today, her and I will be talking about her journey, the trust breakthrough initiatives, and key insights into future strategies. So without further ado, I'm really honored to be hosting Melissa Simmonds. Good afternoon and welcome to African Voices platform.
Thank you.
It's lovely to see you.
You
Lovely
as
to have you in
well.
studio. Yeah. Well, we haven't seen each other in a long time, but you've moved on quite a bit. And I was really intrigued by your role at the Sheffield Health and Social Care NHS Foundation. What does that mean? What do you do there?
So for me, as you know, I started off in the voluntary sector and I started off working a lot around autism and a role. As I was doing that, I talked a lot about autism and race.
Right.
And an opportunity came up at, we call it SHSC, that's Sheffield Health and Social Care.
I have to learn that. SHSC.
SHSC.
Yeah. Mm-hmm.
So a role came up at SHSC to be the race equity community leader. And that was to support our SHSC with a framework called the Patient and Carer Race Equality Framework, or PCREF for short. And that is a framework that is mandatory and that's been brought in by NHS England.
All right, so it's got nothing to do with the Sheffield Race Equality Commission. This is a nationwide thing.
It's a nationwide thing. The wonderful thing about the framework is you have to tailor it to your city. And so I had the opportunity to kind of come in and work with like-minded people to start creating that framework for SHSC.
Right, so literally starting from the scratch. Oh.
It had already started before I got in there, thankfully. A lot of conversations that had been had and a lot of, holding our hands up and saying we weren't doing as well as we should be doing for our communities of colour. So any community marginalised by race or ethnicity, it's around supporting those service users and supporting their carers. And we held our hands up and said, we're not doing as well as we should be doing. Right. And so we became an early adopter of the framework. So we helped to create the NHS England's framework because you had 6 pilot trusts around England. And then you had, I believe it was 6 early adopters. Right. And so they'd been working to support NHS England to create the main framework, and it's due to be launched imminently. It's been launched by NHS England. Okay. And now the other hospitals or the health and social care trusts within England are now aware of it, and so now it's their responsibility to adopt it and create it for their city.
Okay. So this evolution, I mean, you've been very active in it. So what do you think was the incentive for Sheffield to be an early adopter? What was it at the environment here?
I think the people who were at the top of the tree, basically. So our executive team saw the benefits of being an early adopter because the person who was she was the exec for quality and for nursing. She really believed in equity for people, for our service users. And so a lot of the things we were doing, we'd started before this framework started to be created. So for us, it made sense to actually learn more from other trusts, but also be kind of teaching others as well. And that's why we became an early adopter.
Okay. I feel like I should take it back just a little bit because we kind of skipped on you specifically, your journey. You kind of touched on it, but so what, of course you were an activist, but how did that journey begin? Where did it start from? Where did your interest in this area of work start from?
In activism or in
in this mental health care, and yeah.
I don't know one family who doesn't have somebody who's struggling with their mental health. And it could be something like depression, and everybody has different definitions of what feeling low and depression is.
Right.
And then there are people who get clinical diagnoses like schizophrenia or bipolar. So I don't know a family where there isn't a family member who is struggling with mental health difficulties. So for me as well, because I'm autistic, and my children are autistic, and although being autistic doesn't mean you're going to have mental health difficulties, it means you are more susceptible to it purely because you're trying to function in a society and in a world where there's not a lot of adjustments and adaptations made to support you. So for me, it's always been really important to make sure we are trying to support the mental health of our communities.
Yeah.
I think as well, within Black communities, we don't want to talk about mental health. We don't want to examine our own mental health. It's real difficulty for us. And so I've always been really interested in trying to address that.
Yeah.
In my own little way, you know.
Remember, I remember. And I think you used to try and catalyze the community as well as the service providers into sort of working together to understand better how to engage with the community. And it sounds to me like what you're doing with the foundation, SHSC.
Well done.
Right?
Yeah, well done.
Yeah, is a lot like that. So let's go back to that then. Yeah. Thanks. I just wanted to get some context. So what are you able to highlight some sort of innovative initiatives, for example, that SHSC has particularly made you proud of in that regard?
I think for me, the thing I'm most proud of is the partnership working. So as part of the mandatory framework, you have to co-produce and collaborate with local communities that are affected.
Yeah.
And so it means then we're not allowed to work in silos. We're not allowed to create yet another service and then, have people not attend or people struggle with it. So for us, it was really important for us to, from the beginning, co-produce what we were doing. And so for me, in my role as when I was doing race equity, it was my responsibility to work with the voluntary sector. So our partners are organisations like SACMA, which is the Sheffield Afro-Caribbean Mental Health Association, PMC, which is Pakistani Muslim Centre. We partner with ISRAC, which is a Somali community centre, the Chinese community centre. I'm trying to think where else. Fairvale Community Hub.
Yeah, I was going to go that direction.
Yeah. Also an organisation called ACT.
Oh, ACT, yes.
ACT.
So here.
Yeah, we've not done as much as we want to because we had to be realistic. And if we tried to cover everything, nothing would get done. And so, like year one, we had maybe one or two partners. And it's almost like when you think about a pebble being thrown into water and it ripples out.
Yeah.
So the more confident we get and the more we're trusted, the more then we can reach out to more organisations and partner with them. And so I think the thing for me that I'm most proud of is being trusted, because our community organisations had every right not to trust us.
Absolutely, yeah.
You know?
Yeah, true.
And the person, as you know, the person I am, I'm very outspoken, so I wouldn't be able to work for an organisation if I couldn't be honest.
Yeah.
And so when I'm having conversations with these organisations and people within the organisation, I'm like, yeah, we failed you. We failed you for decades. And actually, we are trying to do better. And we value the communities. And we also know that nobody is going to know the community like the community does. you know.
Yeah,
We're not swooping in like white saviors and trying to fix it all.
It's getting in and working with the
Working
partners.
with them.
So what does that look like in practice? So let's not use a specific example. So one of those partner organizations, you go there, you build a relationship of trust, and how do you access the broader community beyond the people that work in that partnership?
Well, it is first of all about building that relationship and being a regular face in the group. So you're not just appearing, harvesting information, and then you're never seen of again.
Yeah.
So we're building proper relationships, and then that helps to build trust. And we kind of ask, like, what do you need? You know, there was a lot of listening sessions where, as a trust, we were told very difficult things sometimes about what we'd done.
Yeah.
And so we listened, we apologised, and we kept going back. And I think they saw that we weren't trying to cower away. We weren't trying to make excuses. We held our hands up. And so because of that, it helped to breed trust. And then we would work with partners. So we have been able to inject funding into some of the partners. Not all, because we also have to be realistic about
what's possible.
Yeah. And so one of the things that we've done is supported some of our partners to hire specific members of staff that work within their organisations that then come and work with us.
Right.
So they work within SHSC as well.
Okay.
So some people will come onto the wards and support with things such as restrictive practice. So when service users are restrained or experience seclusion, which does happen unfortunately. And then we have some partners where they will work on wards, but then they will also have like wellbeing hubs within their voluntary organisation. And actually once a person is no longer an inpatient, there's space there for them to go and still get support.
Right. So within the wards?
No.
Where do they go?
When you're an inpatient, you're on the wards. Yeah. But then when you are discharged, you are then a person back in your community.
Okay.
And we have community mental health teams that you will probably see on a regular basis. But what we find, especially within communities of colour, is that those people will go to trusted elders within the community and go to trusted charities and voluntary sector organisations. And so we're making sure that we were supporting them to have workers and funding to have weekly or maybe monthly sessions where people could go who were struggling with their mental health.
All right, lovely. That sounds really good. Then what about the messaging? How have you been shaping that? How have you been working on that so that it's more accessible to people?
Do you mean language?
Language, but also because you just talked about people wanting to go to the elders within their community. There's something there around how messages are received, how they're shared. So I just wondered how you're working with that.
Yeah, we as a trust, we are very wordy and can sometimes be very corporate and clinical.
Yeah.
And so we're having to learn to talk differently. And we're also having to learn to adopt styles which might not be, it might be something that we've not done before or we're used to, but it's about us immersing ourselves in those communities so that we can communicate and spread that message. Yeah. And so it's about us having translation services, making sure that things are translated to different languages so that they can read the information themselves, but also having events where we invite people to events where we talk about what we're trying to achieve. So we've kind of taken more than one approach because, you know, one size doesn't fit all. But then we also will give funding sometimes to a partner who will educate those communities. So, for instance, we gave some money to one of our partners around autism, and we knew that autistic Black people will not go and they won't access the typical autism charities because they're predominantly white.
Yeah.
So then it's about, okay, so the trusted voluntary centre that they would go to, why don't we make sure that we are getting members of staff from those services and educating them around autism?
Yeah.
So that then they know how to spot it and how to support people around it. But also in doing that as well, we made sure that when people were on the waiting list for diagnoses and they were from a community of colour, they would have that information about where they could go and access further support.
Right. Thank you, Melissa. Just broadening out again, so people are listening and watching the show. So there are those that are not connected to the partner organizations that you have highlighted, and understand that it's difficult to reach everyone. But how can they come to you? How can they access what you have? What should they be doing if they're thinking, oh, that would be something that I should be using as well, that service with you?
I think a lot of times, because there's 3 separate trusts within Sheffield.
Yeah, okay.
So you have the Children's Hospital, which is one trust, and then you have Sheffield Teaching Hospitals. So they would support people, for example, around things like cancer, COPD, you've got a broken limb. So the teaching hospitals are Hallamshire and Jessop's.
All right, yeah.
And then you have our trust, which is this very long word, Sheffield Health and Social Care, Sheffield Health and...
Social Care.
Oh God, I've confused myself.
Foundation Trust.
Yeah, NHS Foundation Trust. And so SHSC, we support people around mental health. So we have inpatient wards when you're having a mental health breakdown. We support people around neurodivergent diagnoses, so ADHD, autism. We also have a perinatal mental health trust, so pregnant women who are struggling with their mental health. And then we also do things like gender reassignment, so we have the clinic for that.
Okay.
And we also do talking therapies. So depending on the support that somebody needs, you know, they're directed to different trusts or receive appointments from the different trusts.
Okay. If somebody was watching and they wanted to know what sort of support would they get on gender reassignment from the trust foundation, for example?
Well, it would, I think what would always happen first is you have to go to your primary care, which is the GP.
Okay.
So we don't provide services where you can just come to us.
So so you are supporting more on the mental health side of things, is that what it is, or?
I mean, for me, my remit's around race, autism and LGBTQ plus IA.
Yeah.
So I support those service users and I support the voluntary sector organisations that support those people.
Okay,
So
right.
that's what I primarily do. But even when it comes to people in their mental health, we tend to see those people if they've received a diagnosis or if they have been sectioned under the mental health trust. So it's not a service that you can just access.
You can't. It's through the partners or the community or the
Yeah.
health service providers.
Yeah.
Right. And what are some of the key challenges, more institutionally rather than on the community, that you see, and also what are the sort of opportunities that you're actually seeing on the horizon?
I think one of the biggest challenges is we're people, and I think a lot of people have very fixed ideas and views, which for some people it's really hard to change what they believe. And because of that, and that happens in most institutions, it means that people don't get the support that they need, whether it's from like homophobia or transphobia, ableism, which is around disability, racism. So it means then people aren't getting the support that they need. So one of my roles is to educate staff around that, and I'm not the only person who does it, but
your team,
our team does it,
yeah.
because I'm part of the engagement and experience team, and so it's around making sure we're educating people around those areas and trying to get them to think differently and to look at things differently. And that can sometimes be really, really hard because of their upbringing, because of their lived experiences, and because of their fixed ideas. And then we rock up and try and educate them, and some people just don't want to listen. So I say for me, that's the most frustrating thing. And also because I'm from the voluntary sector, I'm used to grassroots. If something needs to be done, we act as quickly as possible. But being in an organisation as big as the NHS, there are lots of layers.
That's humongous.
There's lots of layers of policies and rules and obligations that we have to consider before making a decision. So that's hard for me because I just want to act, and I've had to learn to slow down, and I struggle with that.
Yeah. So one of the things you and us at African Voices platform have been talking about is potentially extending that reach through a radio program, for example.
Yes.
What would that look like, and what would you be hoping for that?
For me, it's around education. I mean, as you know, for so long, people who look like me and you, we would be classed as people who are classed as being hard to reach.
Yeah,
and actually, that's really offensive. We're not hard to reach. In the past, we were seldom sought out.
Absolutely, yeah.
We were people only wanted to ask our opinions when funding was involved, or if we were at crisis like COVID, for instance. All of a sudden, people started to realise that everybody wasn't getting the same support and care. And so for me, one of the things I want to be able to do is educate our community. So educate them around mental health, autism, like gender reassignment, so that they have a proper understanding of what services we have.
Yeah.
I also want them to understand what their rights are as citizens of Sheffield, to make sure that when it comes to the patient and carer race equality framework, they know what they're entitled to. They understand their human rights and what that means for them, so that they can access the right services and get the right support.
Yeah.
Because what often happens is, because there is such a stigma in our communities, especially around mental health, they won't access the services, and it escalates and it escalates, and they'll hide, or their family will hide them, and their mental health just escalates. And then we see service users when they're at crisis point. And when you're at crisis point and that's the first time you're actually getting support, it takes you much longer to become better, which then means you're on our inpatient wards for much longer, when actually it might be better for you to be at home and getting support there and medication there. So I want us to, as a community, be proactive instead of reactive. And we can only do that through honest conversations and through education.
Right, yeah. I remember, I think, part of your journey when we were younger,
Way back when,
was that you seemed to be doing this very much in a lonely way. Like, you were very vigilant with it. But how would you say future leaders who are aspiring to fill the gaps that you started to fill, what would you encourage them? What are the strategies? How do you actually thrive in this space?
I always say that I did a lot of my activism and education work for selfish reasons. I wanted to ensure that my 2 autistic children would feel at home in this city. And so my agenda was always to make sure this city was fit for my children. And I know in me working for that, I knew that it would help other families and other autistic people. And so I think one of the things I would say to people is, you have to be passionate about what you do. And that's a double-edged sword, because then if you are that invested in it, if you're passionate about it, then you're going to become exhausted because of it. Because you don't go home and shut off from stuff we do, from the things we believe in.
Yeah.
It's there when you wake up for breakfast. It's there when you get up in the night for a wee. It's there when you're on holiday. You are constantly thinking about it. Really. You're living it.
Yeah.
And as an autistic person, I was living those inequities. I was seeing it in my children and the lack of support. Yeah, I was still trying to fight for the support for families. So I feel it's really important to go into these roles being really passionate, because you have so many doors closed in your face that if you don't really believe in it, you're just not going to get through it.
Right. Yeah. And that passion you hold, that you held then, that you keep holding now, has seen you get a lot of awards as well, being nominated. What's the implication of awards? What does that mean for this work? Does it give visibility? Also to you personally, actually. How and which ones are you most, I don't know whether I would say proud of, but which ones have been most significant for you?
I think being nominated for things gives you a lot more visibility,
Right.
you know, and it gives you the opportunity sometimes to be invited to tables that you wouldn't typically be invited to. So that's what I feel nominations do. I think the thing I'm most proud of, oh gosh, what am I most proud of? I think I'm most proud when like a person might private message me, or I'll see them in Asda or something, and they'll thank me for something they've seen on like YouTube, because I did a lot of YouTube things during COVID, or they've gone to a talk that I've delivered and they've gotten a lot from it, or they've tried to parent differently, or they feel more comfortable as a black person telling other people they're autistic. I think those things mean a lot more to me, because I'm making like positive change in an individual's life.
Right.
And it's what I wanted. I went into this because there was nobody who looked like me in the autism community that was educating people around autism. And I was looking for positive black role models that were autistic to try and encourage my children about, you know, life doesn't end because you're autistic, you can still achieve stuff. And in me trying to do that and then try and look online for examples, and there wasn't any.
Yeah.
And my daughter, I remember someone at school told her that autism was a disease.
Right.
And so for me, it was like, okay, let me go and educate children, because they're like sponges. To me, children are agents of change.
Yeah.
And that's kind of how my activism started. That's how I started on all of this, and it's got me to where I am.
Yeah.
But yeah, individual people
Are the
having a
ones
conversation with me, they're the ones that keep me going.
That's what's happening.
Absolutely.
Yeah. On a more sort of complex way of communicating that, I think the biggest, in the amazing work you guys are doing, apart from, it's not just your foundation trust, but I think across the NHS, when you're talking about the framework and wanting people to engage with it and understand what it's about them and what they take away, where are the spaces where they can have this communicated, apart from, let's say, we create this space on African Voices, the partners, where else can people go to understand how the framework is for them?
I think every city's doing it differently.
And also say what it's called again, the framework, the health?
It's the Patient and Carer Race Equality Framework.
So wordy.
I know. And so that's for every mental health trust in England. And so that's been created by NHS England. And every mental health trust is doing it differently. Because a city like London, we have one mental health trust, but others like London have several. So depending on the area of London you live in, they're creating something different. And they also have the opportunity, there's a lot more black people in those cities, and there are a lot more voluntary sectors that are black led. So sometimes sometimes depending on where you live, there are more opportunities to kind of be a part of it as a voluntary organisation, because we have to work with voluntary organisation. You can't create it by alone.
It's not you going to your GP to find it's the voluntary sector.
Yeah, it's the voluntary sector. And so for instance, we've given some money to some of our partners to create what we call a community development workers. And so a person would go to their local voluntary sector who they trust, and then there would be a community development worker there who knows you're struggling with your mental health because you speak to them about it. And so for them, it's about them being able to signpost you and support you to access NHS services. But it's not something that you can just rock up and be a part of, which there's pros and there's cons to it. You know, if you are active within the voluntary sector, there's always opportunities.
All right.
And so you may volunteer within that voluntary sector and be able to be a part of it. But we always want to hear people's stories.
Yeah.
We always want to hear about people's lived experiences of mental health and accessing our services in Sheffield. We want to know what worked well and we want to know what didn't work well. And we also welcome people's suggestions. And we are realistic. Just because you give us a suggestion doesn't mean we can take it forward.
Yeah.
Also, you know, you may be really unhappy with the service. It doesn't mean we can fix it overnight. But we listen to everything we're told and we try our hardest to act on it and rectify it. It's never as quick as I want it to be.
Like I said,
it's so difficult.
Bureaucracy.
It's so difficult that it's never as quick as we want it to be, but I'm proud of what we're trying to achieve. I'm proud of it, and I'm really proud of the people who I work with, both internally and externally, because they also believe in it as well and want to address it.
Right. Wow, that's quite a lot of work you've got on
I
your
know,
hands.
I know.
I'm thinking, yeah.
Plus raise children.
At the same time.
Yeah. And just do things like, you know, your weekly food shop.
Just
You know.
No, well done. It's
Thank
impressive
you.
what you've got to. Yeah. And if you wanted to say anything as well that people should just pick up on, that's really important. Or what's next with you, actually?
What's next with me?
Mm-hmm.
Well, because my area, my remit has widened, so it's not just around the race equity. Like I said, it's around looking at autism and LGBTQIA plus things. For me, it's about making sure I understand those communities.
Yeah.
You know, because there's always something for me to learn and understand better. And like working with partners from those areas as well to kind of address the injustices that they're experiencing. So that's kind of my next step within my organisation. And we're looking a lot at like population health.
Right.
We're talking a lot more about that and around human rights.
Because you do have some qualification, I think, that says...
Well, we're really proud. Within our trust, we were like the first trust in, I believe it was the UK, to have a human rights officer. And so this is a person who has a PhD and has studied law, in human rights law. And so with us, we always have somebody who we can consult with around the human rights of the service user, around the human rights of the carer. And so what I try to do with all my work is make sure I weave in the human rights aspect as well.
Okay. How easy has that been?
It can be hard. But one of the things like we didn't realise was like you have the Mental Health Act and being within the mental health sphere, you know, it's really important, the Act, but actually the Human Rights Act supersedes it.
Okay.
And a lot of people don't realise that. And so...
In what way?
Under the Mental Health Act, you know, there are some rules and there are some things that mental health practitioners can do. They can take away your freedom. If we're detaining you under the Mental Health Act, we're taking away your freedom.
Oh.
And very few organisations can actually do that. But we can. Mental health trusts can do that along with the police. And so for us, it's really important that even though we can do that, we are thinking about the human rights of that person as well.
Okay.
You know?
Right. And so if the human rights related to the circumstance is more favourable, that's what supersedes the Mental Health Act in that case.
I'm not 100% sure because that's not my.
It's always very.
No, don't worry.
I guess it's case specific. Yeah,
it is.
Yeah.
It's case specific.
It's case specific.
And they take the time to kind of sit down and look at it case by case, which is really important because not everybody has the space to do that. But we're fortunate because we have a human rights officer, so we can do that.
It reminds me of something, actually, speaking very much as a nanny expert, but more somebody who's probably reading news and stuff like that. I think in America, there's quite a lot around conservatorship, especially with celebrities. So under the their mental health, whatever the equivalent of the Mental Health Act. And I think there's been quite a rise, I think, in some protests around that sort of thing. But I just didn't see it translating in the way that you've just explained it to me. A little bit earlier, when you were speaking about the LGBTQI community, and I just wondered, because I used to work in the refugee and asylum seeking sector, and there was prevalence there, and I think that the kind of mental health support that was, is that something that's on your radar? Who are you working with locally here?
It's on our radar because when you think of like asylum seekers and refugees, that is going to have such a detrimental effect on this person's mental health.
Yeah.
You know, and so we are aware of that. Also, you think of that community and then you think of them as well, maybe being LGBTQIA+.
Yeah.
That has a really big effect on your mental health because of the stigma. So it is things that we are aware of, but it's like that ripple effect thing where I have to kind of figure out how and when I start to work with more partners. So I have had talks with some organisations, and I am in talks with some organisations. And I think at the beginning it's for me to better understand what that community needs and what they are experiencing. And that then kind of helps me to look at it strategically and think about, right, what do we need to do to support them, or where can we signpost them to support them? And sometimes it can be as simple as supporting them to write a bid for funding.
For their,
or sometimes they need more support, and when we can't offer it, we have to be realistic.
Right.
But if I had a magic wand, they'd be well looked after.
Is there any chance, are there any prospects of your team growing? How does that look? Because it sounds like there's a lot relying on a very small team of people.
Yeah, right now, no, because obviously we have a new government and it looks like funding for the NHS is to be kind of reduced, or I don't know if the funding pots will look different.
Okay, so we're waiting to see what the budgets are going to look like first before we get there.
So,
I see what you mean.
So for us, realistically, it's very unlikely. We are a small team.
Okay.
But one of the things about the Patient Care Race Equality Framework is we are not solely responsible for it.
Yeah.
So when we're educating our other teams about it, then they have to creatively look at what they are already doing and what they can do to think about race and addressing the inequities that the people who they are seeing are experiencing.
Great. All right, Melissa, it's been so wonderful as always catching up with you. Just wondered if you had any last words, anything you wanted to say, communicate, and then would be the dear to people.
I think as a community, we should be really proud of what we've achieved and how far we've come. When we think about like the African diaspora, when we think about Windrush, when we think about our elders and how long we've been here and the injustices we've all experienced, and we should be really proud of how far we've come. But we're now in a space where we use words like trauma, we use words like PTSD, we talk about feeling depressed, and I feel like we're now in an era in our lives as the Black community to start addressing that and start kind of chipping away at that stigma we've lost too many people by suicide.
Yeah.
We've lost too many people because of mental health difficulties, and we owe it to them to do better.
I definitely do. Thank you, Melissa. So thank you very much for joining me, Chiwe Chihana, on African Voices platform. I was speaking to Melissa Simmonds from the Sheffield Health and Social Care NHS Foundation Trust. Good night.